I am Dr. Vijay Bhaskar, Masters in Orthopedic, Chairman Ethics Committee, Clinical Research and Trials. Today we will discuss about the clubfoot in the newborn babies. The fetus inside the womb, when there is a consensual marriage, a marriage between the children of brother and sister, leads to some congenital disease called congenital equinotalus varus. That deformity, or otherwise in simple words called clubfoot, and due to certain hereditary and certain positions of the fetus in the womb, leads to these deformities. These congenital deformities can be diagnosed with radiological imaging like ultrasound therapy or MRI. When there is a congenital deformities in the body in womb, sometimes if are not permissible, can go ahead for the medical termination of pregnancy. But when the newborn child has a clubfoot, the history should be taken properly and the deformity should be assessed whether the deformity is severe or deformity is little. When the deformity is there, then we needs to explain the parents about the disease and deformity, explain about the cause for the deformity or clubfoot, and then simple manipulations by the parents might recover from the deformity. The foot deformity in such way where the manipulation manually, a mother or father holding the leg in hand and manipulating the deformity foot into a normal position might recover or recovery from the deformity. So initially when there is a born child as a clubfoot, can be treated with manipulation by both the parents. If not, then a orthopedic surgeon will do the manipulation of the foot and apply the plaster for the newborn child, a cloth plaster to retain the normal position of the foot. Even though it is not correctable, then a orthopedic surgeon will correct the deformity and put the POP plaster from the toes to above the knee joint, where it will be there for about 6 weeks to regain a recovery from the deformity, and then there is a proper normal anatomical position of the ankle and foot can be maintained. So these are the conservative line of treatment where 70% of cases will recover, but 30 to 40% of cases due to negligence, due to non-attending of the doctor, or due to the excessive deformity will require a surgery to do the correction. We do soft tissue releases and lengthenings, we do ankle joint corrections, we do foot corrections with the surgical procedure, we do bony corrections and do the K-wire fixation, and we do external fixator also to correct the deformity. These are the various modalities of the surgical treatments where we can treat the clubfoot or CTV to recover from the deformity. We can correct the deformity about 90 to 95%, but there will be 5 to 10% of deformity will be there. You cannot expect 100% recovery from the CTV, at least 2 to 5% of deformity might exist. So hence you should take the care during the growth of a baby in the womb, getting done the radiological diagnosis.